YouTube comments from a video titled, Medical System is About to Collapse. How to Save Yourself. Part 1.
A Jerseniled hand wrote,
Thanks everybody for watching and your kind words. Be well Doctors of Ohio YouTube channel https://youtube.com Dardon's Natural Health Store USA/North America /ojswellness.com Dardon's Natural Health Store UK/Europe /ojswellness.co Dardon's website /dersenildhan.com Dardon's Natural Fat Loss and Insulin Resistance Reversal Program /methrive.com Dardon free newsletter sign up /dersenildhan.com/free newsletter.
At Linda Wade 9647 wrote,
Now I know what the knock was so many times when I have been in an appointment with my doctor. I have even asked the doctor, who was that knocking? They would never respond. And no, I don't have Medicare Advantage.
John DeCarlo wrote,
Perhaps you have covered the rise in urgent care facilities in the US, but I would appreciate what role you think they play in the collapse or rebirth of medicine.
At Janet Hendricks 9125 wrote,
I think the decline started with all the medical malpractice lawsuits and large monetary awards starting 50 years ago. I think this primed the pump to give us the system we have today, where everyone gets treated defensively according to standard of care and established protocols for coded diagnoses.
At Empty Blank 4320 wrote,
The biggest reason is people don't realize they are on Advantage plan the insurance company decides, not Medicare. When you took an Advantage plan, you gave up your rights to Medicare.
At Laura Belgia 8182 wrote,
Retired RT here. My 82-year-old mom got CV and Balat pneumonia, sat 82%, but I kept her away from the hospital and their death protocols and treated her myself at home. She fell and broke her femur during this time, and NOONE in her DR group would call me back as I was requesting immediate X-ray. A week later her DRS office called and refused to let me bring her in for X-ray because she had COVID and told me to go to the ER. Of course the ER wouldn't allow anybody inside and my mother refused, and I knew they would give her remdesivir and put her on vent. Nearly 2 weeks later, now a month had passed with a broken femur. I was able to get her an X-ray with an ortho, which confirmed she had a broken femur. The orthopedist was shocked that it had healed straight and was beginning to build bone, so she didn't need surgery, praise God. He said it was only the second time in his career that he'd never seen that happen. I'm living in America. In California, my mother has full medical insurance, and she went a month before she could get an X-ray for a broken femur. Extremely painful, with no pain meds either. That's the American medical system now. She had severe COVID and a broken femur, and I, with just my RT experience, saved my mother. But the hospitals filled with DRS and experts and pharma was killing the masses. RUN from Alloptic Medicines.
At Halaya 7644 wrote,
Thank you so much for your perspective and validation. I'm a dietitian working in corporatized healthcare. After working in acute care/hospitals for years, I wanted more time and connection with my patients, so moved to an outpatient clinic setting. It was better, or so I thought, at first. But now I see it all for what it really is. Less time with patients, more time charting, higher and higher caseloads. It's a betrayal of patients and us, their providers. We're asked to provide detailed, individualized care under impossible expectations of productivity and better numbers. Thinking of ways to make my way out now. I refuse to keep participating in a sick system. My heart and integrity matter. We all deserve better.
At Owe Waken 79 wrote,
EMERN going on 20 years, currently working in a critical illness recovery hospital, and this is truth. Healthcare today, I as a business first. The patient comes last. It's all about how much prescription medications can be given to patients pharmaceutical companies benefit. Many medications that are unnecessarily prescribed to patients and many unnecessary tests and labs done. Next thing is they give an overwhelming number of patients to the healthcare providers, doctors, nurses and PCTs to care for. It's a heavy load to carry. Most of us do it because we want to help heal and we care. Unfortunately, the hospital corporations, insurance companies, and pharmaceutical companies are dictating the care we give. Point #2 I've taken care of very sick people as a result of poor and unhealthy lifestyle choices and realize many of their conditions could have been prevented. This real people wake up and start taking care of yourselves and your family.
Adleru 1376 wrote,
Doctors who are learning the medical practice now will not be anywhere near as qualified to cure or ever treat patients. Since Big Pharma owns the medical schools, this will be how PPL are treated, by using drugs when other treatment would be a better fit. Learn and use alternative medicine. Heal and vaccinate and be a clean eating human.
At Litzenterfield 1963 wrote,
Not to mention the ubiquitous please listen to this entire message. Then they proceed to rattle off a laundry list of mostly irrelevant things. Some practices haven't even removed their COVID-19 boilerplate 5 years later.
At John Rissler 9794 wrote,
I saw a story on a group of doctors that formed a co-op of sorts that allowed them to eliminate a huge amount of red tape HIPP tie-up bullshit and freed them up to actually treat their patients, even making house calls. There was a very modest monthly fee for outstanding coverage. Prices were published for various services. It was an incredible story, and the doctors were doing very well, and the patients were thrilled as well. I've looked for that story several times, and it seems to be buried. All I could think of was what a true win/win for ALL involved, while the corporate side of the equation could go pound sand.
At Leocat 334 wrote,
I'm fed up with doctors and healthcare. They seem more interested in keeping you sick than helping you get well. The last 5 years, every doctor has failed me. I got sicker and sicker, and when I researched my symptoms, it was obvious what it was, and I just needed an antibiotic. Not giving me the antibiotic left an infection in my body, and I got sicker and sicker. The infection got in my bloodstream and lymphatic system. The lack of caring and interest in helping a person get well shocks me. I fell in my back also, and I'm in severe pain. But there isnooneto treat me. Pain management a joke. They wanted to cut my nerves and told me they'll grow back. They are insane. They could have tried an epidural or deep injecting and referred me to physical therapy. They've done nothing, and there's no good doctors.
At DW 1920 wrote,
I don't think they teach the DRS anything the last 2 young DR I went to when you are telling them what is wrong. They are typing it into the computer, and then they read what medication they will give you, what happened to them knowing in their head.
At William Girl 7735 wrote,
Follow the $$ Lebowski. I've been in and out of the hospital for last 5 po and T5 months. Each time I go back, I get worse. No prognosis. No progress. Sad.
At Gail Bradford 305 wrote,
Healthcare is now run by corporations everywhere. Doctors are told how much time to spend with each patient and which drugs they will prescribe. ITSALL about drugs, NOT healing. Continue drugs, continue drugs, and not one word about changing diet. Sugar should be banned.
At Teresa Grace 3767 wrote,
The charting system is also there to protect against lawsuits. We become more concerned about this than PT care. Why? Because how many doctors are being sued? I am a midwife and this plagues me. We go into the profession to serve, and any mistake, any hiccup, which we are human. We cannot catch everything. Even if they don't feel like I am nice enough that day, I get written up. It's overwhelming. Again, we just wanted to serve, not deal with millions of pages of notes.
At BethFu6296 wrote,
Here in Missouri, they are eliminating all of the mental health facilities. Is all part of the New World Order and the Big Beautiful Bill. They are saying that if you are homeless, that you are either a drug addict or you are mentally ill or a combination of the two, and they want to lock you up against your will and throw away the key. They have actually built camps for these people. COVID cost thousands of people to become homeless here in America. And now they want to get rid of all the homeless. When you get down that far, it is really hard to get back up. I was homeless for 3 years, and because I am an intelligent white American woman, I could not get any help, not even for my 14-year-old teenage daughter. There are very many young new doctors today that cheated to get their license. I know this because I saw a doctor for a brown recluse bite. The first thing he said to me was that is the biggest misconception in the world. Spiders don't bite people. Then he said the sore on my leg was a boil. And he commented on how often I bathed. I bathed daily. That was the third brown recluse bite I have had living here in Missouri for my entire life. I have been lucky to only have had 3 mild bites in my lifetime and have not suffered much damage from them. The one that I had on my leg that I was seeing this doctor for had MRSA in it. He tried to squeeze it like a pimple. This caused the venom to go deeper into my shin to the bone. Because of this, I almost ended up with MRSA in my shin bone. Fortunately, I was smart enough to not go back to that doctor and find me a different doctor. The second doctor I went to for the recluse bite took one look at it and knew that it was an infected spider bite. She did a biopsy immediately. That's how I found out I had MRSA. God bless her because she saved my leg for me. I'm scared to death at doctors today because of these things.
At BethFu6296 wrote,
Thank you, doctors, for so bravely coming forward and speaking to us about this. This restores my faith that there are some doctors out there that are still real doctors. They really want to help people and are not in it for the money. I understand doctors need to make money too, like everybody else. I just don't understand why some of them have to be so damn greedy.
At GingerGirl7774 wrote,
Did any of these doctors recommend the COVID jab? Did they prescribe remdesivir? If they did, they murdered people. The collapse is happening because we the people no longer trust any of you. Ivermectin worked.
As Sharon Harn 5014 wrote,
I live in a small, very isolated Texas town and found only one doctor available out of numerous others, including nurse practitioners. He sat far across the room from me and only came directly over to me when I told him about a heart rhythm diagnosis I have been given earlier. Other than that totally hands-off approach from this doctor, which was atypical until he sent me to a nurse who did actual blood work. This is for me as a senior citizen on Medicare. My supplemental policy to Medicare had reached almost $7,000 per month, which was emptying out my savings, and so I had to abandon it. Thanks for this review.
John Mike M7Y wrote,
My doctor never talks to my face anymore. Always looking at screen. Don't even think he's working in my file. They also have less and less to offer advice-wise. Just refills. That's all my doctor will do now. I was hoping for CBT for insomnia and help for a resource for early dementia in spouse. No joy.
Isabersula wrote,
I'm a retired pharmacist. I left in 2018. 3 weeks ago, I traveled to Newport Beach car to listen to doctors about what they are seeing. Doctors do what they're told. Today, 77% of doctors are employees. If we compare that to 1920 in the US, about 10% only were employees. Today, doctors know that they are not making decisions anymore. I told them they have 3 years at most. If they don't take back their profession before that, they won't have one. As for using AI, I use it all the time to edit copy. I don't use it for medical information anymore because it lies. All the AI I have tried lies about healthcare. So far, I have tried GPT Rock, Perplexity and Claude. I know they're lying because I was trained in 1984 and I kept all my notes. In the Bible, it says that people must use discernment. That is no more true or here because AI has been programmed to lie to you about healthcare in specific areas. If you corner them on it and show them the studies, then they admit they've been lying. They also admit that they've been programmed to lie. So be very careful who your teachers are. Make sure they're real. Make sure they're not biased. Because if they are, you will get hurt and your GPT bot will be long gone.
Bakinger wrote,
Use AI to help. Convert one medical record protocol to another to support interoperability. Create an AI agent to search patient records to help doctors recall patients' history, drug interactions, etc. Create a database of insurance approvals and denials with anonymized patient info to keep insurance honest and have AI write the argument to get insurance to approve. The list goes on and on.
At Guadalupe 9652 wrote,
I totally agree with what you are saying. As a senior with Medicare, it is basically useless. When you see the doctor, they have 15 minutes. In a physical, it is maybe 30 minutes. They no longer doing hearing tests, eye tests, breast exams, PAPs. Just an egg, basic blood work, and they pay for basically nothing. 90% of the time you are sent to specialists for minor things, imaging, and anything past basic blood work. 3 things they are so quick to diagnosis is high BP, A1C, and mental questions. Lastly, all the medicines to take for potentially a disease you may get.
Viravia wrote,
Seeking medical care is cultural. People wait until they are sick, and doctors want to see established patients, not walk in disasters. For those folks, we need clinics, and the urgent care industry is filling that gap. Otherwise, it takes time and forethought to secure a good primary care physician. They will see you if you are sick. They will follow up too, and refer to a specialist if needed.
At Bluebird Farm wrote,
In Thailand, Colombia, and Imshore, you can still see a specialist the same day. See your doctor without an appointment. My wife saw 3 specialists same day, had a CAT scan, MRI, all in a walk-in day. With 3 prescriptions, all this cost us $240. We have completely lost it here in the US. I'm 63. Took me 6 weeks to get a CAT scan for my neck pain scheduled just recently. And took me 2 weeks to get in to see the damn doctor. We're thinking of moving back to Thailand as healthcare is terrible and cost of living is absurd.
At Zach_from_space wrote,
Electronic health records will be put on the blockchain, and every patient will own and control all their health data. Look into Lavita AI. Lavita uses blockchain and AI and has already partnered with 1,600 hospitals. I needs to be doing all that computer/chart/data work for the doctors. The future is also with wearables. Technology that monitors our health and provides deeper feedback that is cataloged in systems like Lavita on a continuous basis. Imagine a wearable like Healy that puts out frequencies that heal but also monitors everything in our body, everything we eat, our air quality, digestive enzymes, and bacteria. It would be able to tell when we have come in contact with harmful microbes instantly. This is the technology of the future. Also, we're in times of great awakening where people's innate healing gifts will be coming online.
At SKM 531 wrote,
I'm 65 now, weird, still feel 35. I can't even get a cardiologist appointment before a year. My cardiologist is at the hospital so much, and the last time I seen him, he was so frustrated. I can't even tell you the last time I have seen everyone in the practice. I go to RPAs. That's fine, but I have so many issues I want to bring up and feel I can only bring one of my problems to them at a time, so I have been doing a lot of self-care and self-diagnosing. Very sad. Thank you for what you do, really caring.
At Once Ada wrote,
I haven't seen a doctor in the past 5 years, although I have a relatively good insurance. The healthcare is operating just like a business. Once you go in, doctors ask for numerous tests and imaging for a completely unrelated issues. Dentists are even worse. Few years ago, I went in for an infected tooth with a swollen cheek. I was told that he won't treat it unless I start a 3,000 gingivitis treatment first.
At Megafiacra 3247 wrote,
When my husband retired in January, we looked at all the options and chose to join a local practice that has opted itself out of the insurance industry. We pay a monthly fee and can see the doctor as often as needed. We also joined a medical cost sharing program in case we have any high cost issues. We haven't needed it yet for ourselves, but it feels good to be a part of a group resisting the problems noted here. It was scary making the decision, but so far, no regrets.
At Darlingusa 2 Petty 57 wrote,
The best doctor I've ever known retired after caring for my mother. He said he could no longer stand the red tape, regulations put forth by people who didn't know medicine, much less human beings, and sitting at a computer when he needed that time with his patients. What a loss when he left.
At Danella Del Hollywood wrote,
I'm not a doctor, but I am a patient and I can see what's happening when people step away. It may take years, though the more people that step away from the corporate healthcare system, the less money they're going to have to manage, and they're going to start cutting back on their personnel and different departments, and hopefully it'll get back to independent doctors being able to practice again.
At Judith Doonan 6749 wrote,
The wellness app makes me crazy. I cannot speak to my doctor about any concern or question. If I do it, then be owns a sickness visit and I get charged. Why bother? I hate it. Was not like that years ago.
At Carlson Lefefter 60 Carlson 11 wrote,
As a child, I was sick with a high fever. The DR came to the house. He told my mother if the fever wasn't down in an hour, take me to the hospital. I got my fever down, but I'll never forget him coming to my room.
At Aunt Nessie U2E wrote,
I just watched Michael Parenti video from the 70s. He's giving a speech on stage talking about healthcare, and I was shocked the one part I heard he went to Cuba to get better treatment. Here's what he said. First, when people complain, they're told, oh, you think it's bad here. It's worse in other countries. They pick a country where it's worse to distract us. So yeah, it may be worse in other countries, but what does that got to do with US here? Second, he said, now, I think it is better in Cuba where I injured my leg. Very serious injury, my Achilles tendon, and I went to a hospital, and I got an operation, and nobody gave me that examination you get in the US. The first examination you get when you go into an emergency clinic, and you can be bleeding from 3 places. THE examinatoin OF your wallet, so to see if you got medical coverage, and if you don't, you're sent to another hospital. You re-dumped on the public hospital, which may be across town while you're still bleeding. It was better in Cuba where I got that operation. I didn't have to pay a penny, and I came back here with a cast, and I tried to get an orthopedic doctor, and I couldn't. I could pay though. I said, I'll pay. You don't understand, I'll pay. And they said, oh, we know you'll pay. We don't take any other kind of patient. But they're all booked, and I finally got some guy who just come out of medical school, and I hobbled into his office, and he looked at the cast, and he said, leave it on for one more week. That's $50. I can tell you that $50, I never resented paying $50 so much. It was better I in Cuba, I in a poor country. I got good medical care. I in a rich country, I'm treated like a beggar and a pariah. It was better in Cuba where I didn't see any kids with sullen bellies and hungry and begging. I didn't see any people begging. It was better in Cuba than it was in Washington, D.C., where I live, and I walk down the street, and I see people in total misery and disorientation standing there begging for food, begging for money, sleeping in hallways. I see that in the richest country in the world. That's where it's better. That's freedom. And when you talk about oppression, sleeping in a doorway is oppression. You want to know what oppression is? Then sleep in the doorways of the land of the free and home of the brave. You want to know what oppression is? Then think of the guys who want to sit there and blow their brains out because they can't pay the mortgage on their house. They can't feed their kids, medical bills piling up, and they see the whole thing falling apart. This is where we are told it's better and a part of freedom. The red menace that's propaganda though tries to direct popular discontent as they tell us don't think you got it bad because it's worse over there you see, and also there's a menace out there, and don't make too much waves here. We are in very serious times. The presidents and media distract us from the real issues of our lives. www.youtube.com.
Kathy Reed 1423 wrote,
I am afraid to go to the doctor or hospital now. It's terrible. It's like they want to kill us. We are just a money source. That wellness exam sucks. I refuse to let the insurance company send anyone to my house.
At Maria Martinez, QD8UI wrote,
My GP is going to start charging a yearly administrative fee of $350 for individuals / $500 for families starting January 1st, 2026. She's the best GP I've ever had, so I'm sticking with her. It was either that or she would have to retire from medicine. Insurance companies are not willing to negotiate with private practice docs. I have Medicare and supplemental insurance.
At Tobe Free wrote,
I remember reading in future things would be virtual and robots. No more hospitals. I thought, how is this possible? Mark of B is coming, and we are in trouble. Can't buy or sell without it coming. Mosquitoes, fungus, bacteria, rabies, cancer, mpox, etc. All new types coming.
At Violet Femme 810 wrote,
I've worked in medicine for 30 years, private practice to small corporate practice to large health system. My medical director quadrupled his income by becoming a hospital administrator after being an employed physician for years and losing money in a private practice with a huge Medicare percentage. Administration is one of the biggest drivers of cost, along with the EMR and the concept of convenience care and the fragmentation of care rather than having a relationship with a trusted primary care provider. Residents, at least in primary care, coming out of school are taught to refer. Primary care physicians know they can make more money seeing multiple patients with acute issues than managing those with multiple chronic conditions. It just takes too long, so those patients are referred to specialists as well. As a result, care is often delayed and becomes fragmented. Doctors sold their souls right along with their practices. Early on, they benefited, but their successors are now suffering, and they know no differently. I fear for my aging health and who will take care of me as I grow old. I'm lucky though. At least as of right now, I'm insured, have decent savings, and know where to go for the best help. Patients, especially those with poor health literacy, are not as fortunate. On another topic, you talk about the epidemic of obesity and diabetes in the young. I worry more about the TikTok generation with the ATHD they are all being diagnosed with, right along with their self-treatment with THC. The ability of youth to function in the professional is sorely lacking. There is much less accountability and work ethic than even a decade ago.
Tobefree wrote,
I'm a heart patient, and I'm afraid to go. Tests have nanotechnology and MRI contrast and other things being put into our bodies, and we are not told. Crimes against humanity.
and Mouse M3S wrote,
TOO many chiefs a Indian OT enough Indians. I worked 34 years in the state university system of Florida, and it was the same exact problem. WAYTOO many overpaid, incompetent administrators a Indian OT enough regular employees WHO were always underpaid, TO complete THEDAYTODAY work.
Tarot to the Truth wrote,
It's twofold, PTs. Feel if insurance doesn't cover. They can't get it, and yet Amazon sells walkers cheaper than through insurance. And yes, notes are legal documents, and we are now checkbox med professionals.
DeFricione 12 wrote,
Insurance ruins the whole healthcare system. It's the biggest scam. If PPL stopped buying insurance, the system would change quickly. Doctors should turn it around and deny insurance.
As Smiley Mac 8017 wrote,
Get rid of insurance. It's the problem. Hospitals and doctors should be in a cooperative. Patients could pay a premium to their local hospital or the co-op, and all hospitals would be in the co-op.
Adeb F6P wrote,
The good old days was paper charting done at the bedside while talking to the patient. Small talk and medical talk mixed. Oh, and when we had to drip meds with a paperclip and tubing hanging on the lights over the bed. And the patients survived and thrived. This computer charting is what caused healthcare to fail. I was one that had to convert. Horrible.
At Darlene Muse 8407 wrote,
In my area, we have two corporations that have taken over the hospitals and physicians. If I use a doctor from one and then need something from the other, they don't have my information from the doctor visit. Healthcare is becoming a monopoly.
At Tynum 2726 wrote,
100%. My question is, what do you think the health insurance industry is going to look like in another 10 years when the upcoming generation starts getting sick from their diabetes and/or autism? Both diabetes and autism is rising and completely unsustainable. I cannot fathom that insurance companies will continue reaping the profits like they have been when they hit the healthcare system.
A Truth Finder 4619 wrote,
Nurses are telling the same conceptual stories. I was a truck driver. That business is in the toilet for the same conceptual reasons. I could have worked longer, but just couldn't take the BS anymore. Almost no professionals in trucking today. The whole country is imploding.
At Valerier 4308 wrote,
Patient care has certainly deteriorated. Doctors assume that because I'm over 65, I can't think or remember, and they push drugs and jabs I don't need. Ever since COVID, I don't trust the medical profession.
At Shannon Eves 8475 wrote,
Not to mention when you do finally get in a room with your doctor and you have multiple things going on, and they tell you they can only address one issue for this visit, and you'll have to make another appointment to address each issue because insurance will only allow them to bill for one thing at a time. It's insane.
At Generuna 8744 wrote,
We have a Christian non-profit clinic. They're very attentive, but all about pills just like others. Why can't Medicare allow us to see naturopaths and purchase supplements? Life Extension has tremendous research on natural supplements. And Christian non-profit insurance stresses healthy lifestyle for health.
At Guess Who 5536 wrote,
I appreciate these doctors and what they talk about. I started going to doctors in 2000 when I turned 50. I was diagnosed at first with fibromyalgia, but since going to several specialists, I'm now diagnosed with lupus, RA, AS, and the associated illnesses because of these diseases/illnesses. I have two great doctors as my primary, and both of them quit because of administration rules as to how long they must spend with patients and what they can help their patients. They quit out of frustration because they wanted to do better care for their patients. The doctor who replaced them did not take time to get to know me or care to help me, but rather judged me on the prescribed medications that were actually giving me a better life. He made me feel I was a drug addict because of taking these prescribed medications, which I didn't ask for. Now, I do not see any doctors. I worked in the natural health industry, and with my work in marketing, R&D in the health food/supplement industry, I have turned to supplements, vitamins and minerals. I've started eating more healthy, exercised, went outside more, and am more healthy than I was while seeing doctors. I am a firm believer in using supplements and vitamins, exercise while making sure the things going into my body are not chemicals. I do not take any prescribed medications anymore.
At Terminator 3728 wrote,
So far, my doctor is still amazing. He listens to me, he sits with me, we talk, we laugh. He makes great notes because I see it in the portal, and he's one of these doctors like Dr. Sunil that will order whatever I ask him to. Sometimes he laughs and goes, okay, we'll order it, but you really don't need it. I love him, and I will regret the day he retires, but thankfully he's a very young doctor from India, and I think he's going to be around for a while, so I'm going to hold on to this guy for my other loving life.
At Jennifer Drozd 2835 wrote,
A relative is a case reviewer for Prominent Insurance Co. An AI-generated report included an incorrect word that drastically changed the report conclusion. Fortunately, she caught it as she is a diligent reviewer. Wonder who is legally responsible for AI medical errors as it learns.
At Maram Klein 830 wrote,
It's already collapsed. In Oregon, as working poor on OHP with a very complex genetic illness. I had any actual me as a PCP in 8 years. She in 2018 went through my family medical history and gave me the Baton score test after I asked could this be hypermobile Ehlers-Danlos instead of fibromyalgia. After an hour together she said this, I know you have this, we traced it back 3 generations and it likely contributed to your father's sudden early death of aneurysm. You know you have this. I won't be allowed to diagnose you. No one here wants the SSDI paperwork. You will keep getting referrals for specialists, they will get paid, and you will still not get the diagnosis and treatment you require. There's one woman who diagnoses this, she's got an 8-year waiting list. If you want proper care, you must leave Oregon. This is my very last official act as a doctor. I am quitting medicine entirely because I am sick of not being allowed to actually help my patients like you. We were crying by then. Took me 7 years to get out of Oregon to Oklahoma. And 4 years of zero income after becoming disabled entirely by Eminra. I embrace my injury now because it freed me from a lifetime of lies and indoctrination. I will never trust doctors and the Western medicine establishment, not ever again. It's heartbreaking for all of us. You all need to keep doing this and telling the establishment to F off. There's excellent young MDs who are going back to single practice and making house calls too. People pay monthly fee for access and treatment. It's very difficult, but people are finding new ways to cut free from the medical industrial complex. Perhaps RFK will be able to get doctors focused on true healing using proper nutrition as a base.
At Jody Gonzalez wrote,
I'm a medical coder in the USA who has been doing this for 20 plus years. Once Epic became a thing, I could see the end of it coming. All I do is count boxes, and if the questions about history aren't done each time you lose points for charging the insurance. It's all about money. I code both inpatient and observations, which are the same codes I use to love my job. But seeing what my job has become, I can't imagine how caring doctors feel. It's becoming checking boxes, forcing pharmaceuticals, and making sure the paperwork is in order so we can get the money. After having my own scare and feeling like an experiment and like I was part of an assembly line for surgery, and being chastised for refusing a certain shot, I only go now if I need it. All the good doctors quit except a select few. The new docs barely touch you and are rushing into the next patient.
At Tom Westling 7065 wrote,
This was a sad podcast, but absolutely true. As Michael Malice says, society is rewiring itself. These problems of overregulation are occurring in many professions, industries, not just healthcare. I believe there are enough great minds in clinical care that new ways to deliver care should emerge. However, if we move closer toward big government, democratic socialists, we will have less room for innovation and move toward a dark age. You gave us two important take-home messages. 1. Take care of your own health. 2. Learn how to safely use AI. I will take that to heart.
At Faithin 8338 wrote,
We've become income generators and the humanity has left medicine. I left allopathic medicine as his former patient 6 years ago, but stopped all pharma 12 years ago and eat a vegetable, high protein, low carb diet and walk 30 minutes a day. At 76 I'm healthier than 56 pharma was killing me. My BG and BP are great, and I also lost 145 pounds getting off pharma and eating correctly. No processed foods. Lots of eggs and butter and water.
At Erknick wrote,
At 1850 and still, many in the US think that the USA is number one. It is a joke. 35-38 stop mandatory vaccinations. Why do you think we have so many young people sick? The information has been out for years. The vaccines stop some illnesses, but on the other hand, so many other illnesses propped up later in life. At 3600, a whole new system, God willing. Thanks for the video.
At Faithin 8338 wrote,
You are spot on. Percent BUT beware, OFINOT good. No humanity our soul. Only fed information, but not heart. I know of people being led to suicide that seek help for depression.
Echo 7243 wrote,
Big Pharma needs to be burned to the ground. They are the problem with all medical care in this country. They create the illnesses and then they create the cover up the symptoms medicine. They get wealthy and we get sicker and poorer. Disgusting that we deal with this in the USA.
Echo 7243 wrote,
Venture capital companies and insurance companies need to get out of medicine. Doctors need to rebel against this takeover and stand up for themselves and medical care.
At Lori 5457 wrote,
Sorry to say, But welcome to every professional's world. My profession went digital/computerized decades ago, and it's been downhill ever since. Now most employees are young kids that major in PowerPoint displays or computer skills, versus understanding the data and information the program is putting out. They're clueless.
A Patriot for Health 9048 wrote,
Thank you so much, DRs, for all of your podcasts with important and insightful information. I've recently found the channel and subscribed. I am a hospital pharmacist who would much prefer to be involved in holistic education to replace the declining medical mafia system we've found ourselves in. It's amazing to me how many in healthcare apparently have no clue why they themselves have so many health issues and seek a pill for every ill. No clue that the food they eat horrible or their lifestyle has any effect on their problems. Recently, I attempted to explain metabolic health to a pharmacist coworker who has gained weight and doesn't know why she can't lose any. She wants to get the GLP-1 shots instead of changing diet/lifestyle. Education is vital to inform what many seem to assume is genetic or happenstance when health issues arise. As to the declining medical system, it's my understanding that a parallel system is in the works, hopefully to expand quickly as so many are in need. One source of this information is a provider from Synapse Center for Health and Wellness, a functional medical clinic in Minnesota. They have provided care to patients from all 50 states and other countries. No, I am not an affiliate. Even the Mayo Clinic has referred patients there when they can't adequately help their patients. The good doctors above may want to contact them to obtain information about the parallel system. I am very excited to hear this and hope to play a role in some way.
At Davidiers 5173 wrote,
Our medical industry is drug pushing DRs, pushing big pharmaceutical, and nothing else. Few DRs are trying to help the patient. Most just want to prescribe more drugs to treat the symptom. We need DRS that look for the root cause and help the patients.
At Mermaid Moxie wrote,
RN since 1996 here. Back then, I was told by the older nurses that once businessmen took over healthcare in the 1980s, it destroyed the system. God bless you all.
At Star Volcano 2549 wrote,
What I witnessed in a rehab hospital with my father does not deserve any kind words. We were lied to by doctors and nurses. They tied my injured father at night because they did not want to check on him during the night. He told us how they abused him. I cannot go down the road of horror, but it wasn't just miscommunication that was the excuse, but they had great communication in how to lie to us and do things behind our back. These long-term hospitals get a payout if they keep patients past a month. It's a money-making system that uses us to our fullest and then has a kill switch that the insurance enforces. You cannot be honest about it or you would not be able to be in the system, but you do have a choice and you should get off the fence and join the PPL and help end this evil that you are tied to called the medical industry.
At Stone 7337 wrote,
If doctors really cared for their patients, they would take more time listening to what could be going on psychologically or emotionally with the patient instead of automatically putting them on pharmaceutical drugs. It's criminal.
At Shirley Cook 1589 wrote,
I became cynical about 5 years ago, but I have hope that the system will end up improved. In my opinion, internet makes it harder for the corrupt medical system to get away with their money-based schemes. I try to teach my kids discernment on the web, not to get their information from ads, but from doctors who teach online and researchers who show the data, the double-blind tests, etc. Dr. Robert Lustig's book, Metabolical, taught me how we got to where we are today, the history of our food and medical systems. Also, Gary Taubes' book, Rethinking Diabetes, has great detail about history of our eating/medical culture.
At Lifestation Express Linda 9425 wrote,
Yes, you all are amazing. Post small stroke, I researched and found a sustainable solution. Then, I had to teach my doctors what I learned. I now only have one GP and one annual exam for Medicare. Keto and nattokinase for the win.
At Livia 1256 wrote,
The best investment I made in myself and my family was becoming a nurse who is smart enough to realize the system is not one I want us to be a part of. I worked briefly in a primary care clinic and it was so crushing.
At Mohawk 7335 wrote,
Let's be real, the medical system today are controlled by the pharmaceutical industry and influenced by Satan himself. They murder men, women, and children with their bioweapon jabs and make drugs to acquire billions on the suffering people they have murdered. If that's not the most evil acts in the world, I don't know what is.
At Four Stones Handcroft wrote,
It is easy for us to see our wonderful concierge PCP, and we pay a painfully large portion of our very limited income for it. Almost anything beyond that is a nightmare of scheduling 3 months out, cancelled appointments, 10 minute appointments with a distracted doctor who is a dealer not a healer who offers a pharmaceutical, or a procedure that looks suspiciously like it will profit them more than us.
Adita Dakamasu wrote,
I funny have insurance and don't qualify for government coverage. I went to a charity hospital because I'm in college, only making about $50/week and living on retirement, which was only a few K and is almost gone. They didn't approve me for their care insurance because of it and raised my ER bill because I have a lawyer for a recent wreck.
As Suki Frugalfrau wrote,
I am at the point where I am seriously considering totally opting out of Medicare. Why bother? It is useless. If I have an emergency, I think I will choose to weather that storm or die. I simply do not want to contribute to the fraud and deliberate harm for profit system. How about I just spend my Medicare premium on an independent physician?
At Greg Gibson 5575 wrote,
How to save yourself. Don't support the medical industry. These medical people are not your friends. Your death is part of their business model. Keep the public sick, suffering, and dying. Haven't been to any medical professional in 5 years, never been healthier.
At Diana Mullins 9475 wrote,
Medical system is not collapsing when you have your state government paying off irresponsible people's medical bills. Socialism at its finest. NC just paid the medical system here with tax money. As well lowered the education system standards so kids can graduate, which brings more money. Democrat ran state. Also just approved a 30-story apartment building, so when you stay there better ask for a parachute. If you are smart people, stay out of the cities.
At Lori Pritchett 6772 wrote,
The heirs refuse to care for the needs of the patients. I begged them to x-ray my back, and they would not, or to call in an ear's noise and throat for my sinus infection, they would not. When that is the cause of my stroke. But they said it was from Claritin D.
At Name U8MH wrote,
You're not doctors. You're gogglers with degrees on how to have something or someone else do everything for you. Doctors kill more Americans than drugs and all forms of gun deaths combined. Very few are doctors these days. The younger generations are all quacks.
At Night Through Tachman Lack wrote,
Thank you. I've not heard this kind of concern and care in many years. We are living in an atmosphere now that the movie Soylent Green showed hospitals are places to profit and eliminate people, not care for them.
At Ladillian Teeth 3952 wrote,
What's it like these days? Are patients coming through rattled from being mistreated by the system? What can you say? Do patients have recourse or are they stuck with it?
At Strawberry Champagnetica 1193 wrote,
I'm a RN in Phoenix. I see often the hospitality doesn't even see the patient in their room. They just place orders off of what I message the patient needs.
At Mountain, Mary, Mountain wrote,
It's terrible in UK. If you call the GP surgery, you never see a doctor. I need to see an ophthalmologist at the local hospital. The DR I had an appointment with in August, it was cancelled. Have not been sent another one yet. Turns out he left, and they have not found a replacement, and none of his patients are getting appointments till they find a replacement. I'm struggling to cope. A few weeks ago, I had an accident, hurt my wrist, was in a lot of pain, went to it, and he only saw a nurse, had an x-ray. She said she couldn't see anything, gave no advice. I left. After a week of constant pain, I went back and asked for another opinion, another x-ray. Saw a different nurse. He said, "Your radiology report came back and I had a distal radius fracture." No apology, no explanation why they hadn't rang me. Luckily, I don't think I did more damage, as my instinct had me not using and protecting my wrist. LTS getting more and more shocking. We all have to rely on ourselves. It was reassuring when you could see a doctor who knew how to try and help you.
At Gemma Designs 5553 wrote,
If the government of the people would insist on the old-fashioned training of medical doctors, we now call integrative osteopathic medicine. These have additional training on the science of the body, not just pharmaceutical-directed memorization, is now only required in gaining your license, and so gives them money to the university schooling. I, as a patient, have discovered that the insurance companies will cover if the doctors will ask with supporting reasons, but the corporate entity hiring the clinics have policies requiring protocol before asking for certain tests/radiology, and all the notes are just forms with CK boxes, with no thoughts from the doctor even verbally at the end of the appointment.
At Willow Soul 3 wrote,
Trump is coming down on the Rothschilds/Rockefeller, etc., removing money access. Since they made all their money in insurance and pharmaceuticals making people sick, they want it back. Karma will always win in the end. Unfortunately, the people suffer. We have to go through growing pains. Hopefully won't last long.
At GrungeFan 2018 wrote,
I still cannot believe they added another layer with PBMs. Insurance Co. were bad enough. How can we get rid of these MTHRFers? I'm a healthcare provider, and I am so stressed, beaten down, and disgusted. I'm also a patient, and it's a FKN joke. I have to spend $1,000 cash every month to pay for my own DR and a chiropractor and counselor. On top of the horrible insurance our hospital conglomerate offers. It isn't cheap either, but I'm 62, so I have to have it in case I have to go into that godforsaken hospital.
At Zero Anonymous wrote,
In order to build something better, there comes a time when you must first take it down, and only then can you build back better. If you build back better, the medical system should only be for emergencies. So that means everyone will have to dial back to the day when they took care of themselves, and only doctor in an emergency services would still be available. But the overuse of the medical system would be on a strict forced diet if you CUTOUT what's NOT necessary. We see and eliminate corruption in our medical field.
At Bill F3I wrote,
I knew we were headed down a road to perdition with Obama's introduction of the ACA. As Pelosi said, let's pass it and see what we've got. I am a senior who's been active all my life but have succumbed to Parkinson's disease. What a bummer. First thing I would suggest is eliminate government control or minimize its impact, as it only has created a bureaucratic system that's only function is to perpetuate itself. How's that done is the problem in itself. I'm encouraged by you gentlemen speaking out so openly and candidly. And I await your suggestions. Godspeed and the best to you all.
At Terracotta 4246 wrote,
My mother-in-law quit her RN hospital job to become a private nurse. She told me that everything in the hospital changed for the worse through the 1970s, 1980s in Canada.
At Narsinga 2024 wrote,
My plan to reform: 1. Cancel all doctor student loan debt. 2. Return to cash only option subsidized by the government for seeing a doctor with a plan to off ramp. $20 per visit. 3. All labs should become affordable and available nearby, just like COVID jabs were now that we know it is possible. 4. For services at the hospital, pay a fee to access again subsidized. 5. Reduce regulations to let doctors from other countries immigrate without requiring courses. 6. Give an AI tech to every doctor that can take down all notes and organize them all in EHR and submit the visit to states automatically. 7. ALL without insurance, AS insurance, IS a scam. 8. For medicines, make them all available at same price as developing countries, but control the quality via strict FDA controls. 9. Improve food quality and nutrition by banning artificial ingredients. 10. Give tax credits to people who are healthier compared to last tax year.
At Georgiadim 5333 wrote,
Thank you so very much for all your important information. Unfortunately, due to the fact that only a small percentage of mankind is in a position to resist, the situation will only but get worse.
At Devorasi 961 wrote,
The problem is to even get an appointment with a doctor. Lately, I have to see a nurse practitioner. I respect them a lot, but they don't know what a DR knows.
At Devorasi 961 wrote,
You are so right, doctors. We are going to die for not receiving care. There are not enough doctors. And the ones who are working are overwhelmed with what the stupid system busy tasks. I am scared of getting sick.
At Aurora Knight wrote,
Good discussion. I've concluded the moral damage is directly due to our collective COVID experience. We lost respect and trust in doctors having our best interest in their care plan of get the jab or else dictate. As we now know, they were dollar compensated for every jab they gave. We now see the damage these interventions have brought. In my social circle, 2 suicides, 2 turbo cancer stage 4 and dead within week of diagnosis, 1 premature dementia and death, 1 pulmonary embolism, now on meds which they struggle to afford, ER visits for GI issues within days of receiving vax. Yes, all you mentioned as a patient I've encountered. It's why DR Don's channel has grown, as have other DRs. The medical office I go to, staff shared many quit during COVID and took early retirement. They became so burned out. I find this disturbing that they gave up when the need of humanity was so great.
At Kathia Hedrick 3 wrote,
I'm currently looking for a DR of functional medicine because of the very issues you are discussing here. I have a 30-year background of using alternative methods or medicine through natural sources. This all started when I had a terrible period in my life 37 years ago with anxiety and panic attacks before and after the birth of my first baby by C-section. It progressed for 3 years after his birth until I couldn't take it anymore. I cried out for help and my family had no idea what was happening. After 3 months of therapy, I bought lots of books, went to support group meetings, and gradually educated myself as to how to cure myself. I started my own therapy group, and I was the facilitator and organized everything needed for the people who made to me at my church location. Once a week, I was an on-call after-hours phone support therapist for 1 week a month, and by this time I had a second baby and my parents were getting older and not healthy who needed my help. It was a very busy, hectic time. But I made it out on my own and went on to live a much better, healthy life. I'm living proof that if you put your mind to it, even without much medical help, you can get through some health issues if you research. Don't give up. There are many ways to help yourself if the medical system melts down. Thank you for validating my thoughts on where the US medical system has been. I've seen it and experienced it since I was sick with COVID. I had the first 2 jabs, became very ill, and I'm now living with long COVID, ME/CFS, vaccine injuries, and I don't have a doctor. Long story to my life at 63, I no longer think about it or care to try and find a good DR. None have helped me yet. So I accept what is to come. I am ready because I knew this collapse was coming by way of my own observation. Thank you and best wishes to all three of you.
Etericadon Arado wrote,
I have said this for decades. If all the electricity goes down in the US, you will be thankful for us old people in medicine who will actually know how to take care of you.
A Country 10 1365 wrote,
I remember when I started nursing school back in 1976, I remember overhearing young doctors in an elevator talking about socialized medicine, and just those words sort of scared me. That has begun, I do believe, slip into American medical systems, especially the insurance companies and especially Medicare Advantage companies. They have been, and I believe some still do, denying claims where patients need surgeries and other urgent treatments. God forbid any of us go through this. Got to trust and depend on our Lord Jesus for healing and help.
At Rugged Camper wrote,
The most significant conflict of interest hypocrisy with the most associated harm has to be insurance companies, with CMS leading the pack, telling providers how to diagnose and treat patients. I'm an RN going on 3 decades in the acute care industry, with the last 10 in quality regulatory data analytics. The emerging consensus seems to be that conditions such as metabolic syndrome and insulin resistance are very often the cause of an array of GI, cardioneurological, and other problems. And yet we treat those symptoms with medications that cause underlying metabolic, endocrine, and electrolyte imbalances, as well as anemias and kidney problems. I can show the admissions and readmissions data to back this up. The established medical commercial complex is making people more chronically ill because this serves the needs of corporations that want to sell drugs, the same entities who have lobbied CMS and affiliated scientists into creating best practices around specific conditions and treatments in a manner that has taken doctors and providers hostage to their regulations in order to receive payment for care. This value-based purchasing nightmare has made hospitals very good at analyzing data and using it to further push this agenda by making it easier for doctors to comply. Well, it's ruining lives and saturating community clinics with more chronically ill patients than they can manage. So, not only do patients get subpar care, they get bombarded with pills that are band-aids for one problem while creating 2 new problems. I was being thrown around between neurosurgeons for chronic back pain, cardiologists for hypertension, dermatologists for eczema, and private practice for anxiety after a traumatic event. Well, guess what? I decided to educate myself. I reversed my metabolic syndrome and cured my insulin resistance, overcame my chronic pain and became strong, cured my eczema and hypertension, and became alert, calm, and focused. I did this through years of painstaking dedication to core strengthening and exercise like rucking, which fixed my neck radiculopathy too, and Navy SEAL burpees, amino acid and electrolyte supplementation, and eliminating processed foods and drinks. NAC cured 10 years of eczema within 4 days, as an example. I don't take prescription meds, and I will only seek medical attention if I become acutely ill. Besides, my PCP is canceled and rescheduled my appointment 3 times in a row now, and I don't care.
A Conniecock 4877 wrote,
The root cause of where we are started when the unions got workers more pay that wasn't taxed by having the business provide the insurance. This has driven up the cost of medicine since there are so many middlemen taking their cut, and because businesses change which company they use sometimes as often as yearly. People keep having to find a new doctor because the network changed. What needs to happen is for companies to pay their workers more, but no longer provide the insurance, and each family get the type of insurance right for them. Because it is their own insurance. they will also become more enlightened consumers. While so many people bash doctors as the problem, in reality, they are employees and pawns of a much larger dysfunctional system with little ability to change the requirement for businesses to provide insurance.
At Dar 3375 wrote,
Just like auto insurance, the car needs body work after a small event that breaks something major on the car. The insurance company charges a surcharge where you pay every dime of the cost of the repair, plus interest. What is paying for insurance monthly when nothing is actually covered?